We started to recognize early on in the pandemic, probably towards last summer, that we started to see people with long-term effects of COVID, and we decided that we needed a place to follow them and help them through this journey.
Mm-hmm. And when did you open your doors at this center?
I don't recall the exact date. Wendy can help us get that.
Okay. Mm-hmm. Is it safe to say you've been doing this for 6 months?
For a year, most.
A year now.
Mm-hmm.
Okay. Very good. Any idea how many patients you've seen over that year?
We're actively following a little bit over 1,000 patients since we opened our doors.
Beautiful.
Mm-hmm.
1,000 patients. Okay. Very good. So let's talk, first of all, Doctor, just can you tell me, let's leave it with the top four. Can you tell me the top four serious medical conditions that people who have survived COVID-19 are coming to you with?
Very well. So first of all, I'd like to really tell your viewers something that most people think that COVID is live or die disease, right? Most people are concerned about dying, but there's a third outcome, which is in between living and dying, which is long COVID. And this is a condition that is very, very difficult to address. A lot of patients are presenting to our Center of Excellence with long-term care, long-term symptoms. And the most common symptom that we see is fatigue. People have this deep, deep fatigue that they just can't get out of bed and can't function and can't go to work. Second most common symptom that we're seeing currently is the famous brain fog. They have difficulty concentrating, difficulty processing data, processing their normal lives. They basically describe this as having literally fog in front of their eyes where they can't really focus on things. They can't concentrate. They have trouble doing math. They have trouble following a TV show. They have trouble working. So very debilitating, very difficult to study and to really help them with this particular issue. We have an outstanding team of neurologists here at UT Health that has shown changes in the brains of people with long COVID, changes that are sometimes similar to those that we see with low blood flow in the brain. And we're barely scratching the surface here. Again, we do some cognitive therapy, some rehabilitation, memory exercises, concentration exercises. And this is one of those signs and symptoms that takes a while to resolve.
Can you tell me how severe the lung problems can be? What they are? What kind of lung problems are you seeing?
Yes. So after COVID, we normally see some lung damage. We actually are coming off of a stage where there was an actual lung infection that creates a lot of inflammation in the lungs, and it takes the lungs a long time to recover from this. And sometimes we see scarring in the lungs. So some of these patients progress to what we call lung fibrosis. The lungs become hardened and they don't work as well. And it's very disturbing for these patients to be sort of walking around with oxygen tanks, being dependent on oxygen as well.
Lastly, the heart. Can you tell me how bad it can be with the heart problems that you're seeing? What are the heart problems you're seeing, and what is the therapy there?
So most of the patients that we see that have heart sequelae of COVID have rapid heartbeats. Their heart is kind of a little bit out of sync with the rest of the body. So they have what we call dysautonomia, which is when you get up all of a sudden, you have really rapid heartbeats that is not proportional to small movements, etc. So a lot of our patients complain of, again, rapid heartbeats, and that is very distressing for people. It diminishes your ability to exercise and to live your normal life. And it's a side effect that is very, very distressing for people. Another issue that we see after COVID is an inflammation of the heart, um, where the heart is really inflamed and doesn't work as efficiently. And these people end up having heart failure, accumulating fluids in their body, and require multiple medications to handle sort of the recovery of the heart. The good news is for this heart inflammation, it usually resolves within a few months, and we're able to take people off medication. But we're, again, barely scratching the surface as to what the long term effects in your heart are going to be. Are people going to get more plaque, more sort of heart attacks down the line? We don't know yet.